Hi, this is David Mack III with another edition of the Committee on Better Racial Assurance Sickle Cell Empowerment Series. And this is part 2 of the 10 steps for coping with a chronic disease. And as we said last time, sickle cell anemia is in fact a chronic disease. A chronic disease is a disease that persists for a long time. Chronic diseases generally cannot be prevented by vaccines or cured by medication, nor do they just disappear. Chronic diseases don't end. What is sickle cell disease? According to the Center of Disease Control, it is a group of inherited red blood cells disorders. The red blood cells become hard and sticky and look like a C-shaped farm tool called a sickle. Sickle cells can get stuck in small blood vessels and block the flow of blood and oxygen to organs in the body. These cells changes can cause repeated episodes of severe pain, organ damage, serious infections, or even stroke. Sickle cell disease affects millions of people worldwide and is particularly common among those whose ancestors come from sub-Saharan Africa, regions in the Western Hemisphere, South America, the Caribbean, Central America, Saudi Arabia, India, and Mediterranean countries such as Turkey, Greece, and Italy. The pain and aggravation of a broken bone, burst appendix will end. They will heal. Not true for high blood pressure, heart disease, diabetes, and sickle cell disease, which are chronic conditions. Because they're chronic conditions, again, they're not going to end. We just have to know how to deal with them. So we're going to do 6 through 10. We did the first 5 on the last session. 6 through 10. Number 6. Make it a family affair. Talk to family members. Invite family members to join in, which gives you a support system. You want to be able to communicate. And that support system, that family, that love, that connection, people that are close to you is very, very important. So you want to be able to share information with them and to have them on your team. Number 7, manage your medications. Know about the drugs you take, why you take them, how best to take them, what problems to watch out for. Talk with your doctor, nurse, or pharmacist. Learn the side effects, if any, and what to do in the event you are impacted. And again, knowing about those drugs. You don't have to be you don't have to have a science background to know that. Know the basics. And again, you should have a physician, a nurse, and a pharmacist, a medical team that will take time and communicate with you so you could understand what's going on. And then that way you can better take care of your responsibility of managing your medications. Number 8, very important. Beware of depression. Yes, a part of mental illness. That's something we don't like to talk about in the black community. But there's nothing wrong with that. Just like the heart, the spleen, the liver, the kidneys, you can have problems with the mind too. It's a normal part for people to sometimes be down and to be depressed, even depressed. But you can't stay there, and you have to know what's going on. Dark and dreary moods plague a third or more of people with chronic diseases because it's serious. Depression can keep you from taking medications, seeing your doctor, or pursuing healthy habits. That's one reason, as I said in number 6, having that family support system to help you. Read up on signs of depression. Let your doctor know if you think you are depressed or heading in that direction. You want to be able to acknowledge it. You want to be able to do something about it. And you want to just understand that there's nothing, quote unquote, wrong with you that cannot be fixed. We all get down sometime. And having a chronic disease can take you there in a very bad way. So you want to beware of depression. Reach out. Look for a support group or an empowerment group or for empowerment sessions. Talk to people who are going through what you are going through. We've seen that in various situations with various conditions. Also, very, very true, very much important for folks that have a chronic condition. I've been doing sickle cell counseling now for a long time. And a lot of times I can give sickle cell patients all the technical information, all the scientific information. But I have seen sometimes somebody with the actual disease themselves talk to somebody else and make them feel better. Get them to understand some things a little bit more as relates to them. Help them deal with it. So again, that support group, that empowerment group, empowerment sessions are very important. And it doesn't have to be formal. Talk to people that are going through what you're going through. Not only with your disease, but it may be other things in life. People that you trust, family members that you trust, good friends that you trust. Be able to share, be able to build off each other. And number 10, something none of us like to talk about. We don't like to think about. But again, as I've said in all of these series, all of these things that we're talking about can benefit all of us, whether we're dealing with sickle cell disease, a chronic disease, or not. Number 10, plan end-of-life decisions. Do you want aggressive care to the end? Hospice care? Do not resuscitate order if your body is shutting down so that you may leave this earth in natural order. That way, no one has to determine when to pull the plug. Be responsible. Deal with all the issues of life and realize we will not live on this earth forever. But our spirit, which is the life that is released at the end of life, lives forever into eternity. Prepare in this life for life after death. Learn what you need to know to prepare for the next life beyond this earth. And as we're saying all this, the simple aspect of having a will, making sure your will is in order, life insurance, all of those type of things. We don't like to talk about it. We don't like to think about it. But it's one of those things of being a responsible individual. And it's something else in terms of preparation to put your mind and soul at peace, knowing that you've been responsible for yourself and towards your loved ones. Again, this has been another edition of the Facebook, YouTube, Sickle Cell, COBRA Sickle Cell Program, Sickle Cell Empowerment Series, Part 2 of the 10 Steps for Coping with a Chronic Disease. And again, as we always say, this is designed for individuals that have sickle cell disease and their families, but it's information that all of us, including myself, can benefit from. Thanks for watching, and we'll see you next time.